So we're here for an edition of Innovations in Education for a Big, Bold Future, a special 30-minute conversation with Alison Davis, who is with the Community and Economic Development Initiative of Kentucky, which is housed at the University of Kentucky. And we want to talk to Alison today about a report that she released in March, which really dives into the issue of the digital divide. So those who have been following us on Facebook, watching our innovations programming, know that the digital divide and access to broadband has been an issue that comes up in many of our conversations, and that we have dedicated work around, recognizing that through the pandemic and even after the pandemic in a new normal, remote access to work, remote access to learning, and remote access to healthcare are going to be an imperative for Kentucky to have a big, bold future, and a big, bold future for all of our citizens. So I'm pleased to have Alison Davis here with me today to talk about her report and kind of what she sees on the horizon. Alison, welcome.
Well, thank you so much for having me today.
So Alison, just give us some background. The report that you released in March is called, and we will link to it in the comments on our Facebook page, so citizens can access it as well. It's called Which Kentucky Communities Are Most Able and Which Are Most Vulnerable to Take Advantage of the Shift to Remote Work. And we could probably then in parentheses put remote learning, remote access to healthcare. So give us some background on why you did this report, and what you learned.
Sure. So I have a colleague at Purdue University who has been a leader in this area. And so when he tends to start working on something related to the digital divide, I'm always very interested in learning more about that and how it can apply to Kentucky. We don't have a lot of research in Kentucky around access to broadband and its importance for health, for economic development, and for education. So I look for him as a leader. About halfway through last year, we had produced these digital divide profiles, county profiles for every county in the state. And I found them super interesting because we believe the digital divide is comprised of both the infrastructure you have in place, not just, the hard, the dark fiber or the cable, but also, do your folks within that particular area have subscriptions to services? Do they have computers? But then also, even if we provided that infrastructure, would folks know how to use it or be able to use it? So we looked at things like poverty, age, disabilities, and so forth. So I started looking at that, and I work a lot around the state. And in many of the rural places, broadband is a significant priority. It's a very, very expensive priority. And folks are asking for some kind of short-term fixes to try to get it so that they have the access for everyone. And we've been frustrated about data because the FCC data make it look like we're more covered than we are. Okay. So fast forward.
And I'm going to hold up for folks, and we'll link to these as well in the Facebook comments because watchers can pull up a profile for their county. So there are 120 profiles going over the topics that Alison just listed. The top one being kind of the digital divide index score.
Yeah, so the lower the number, the better for that. If you have a score of 100, which we actually do have a couple of places, that is really suggesting that you don't have the infrastructure, and then you don't have the sort of the setting that you don't have the ability to nurture folks to use the internet.
Okay, so yesterday we had the superintendent from Ballard County, I'm sorry. Casey from Ballard County on our Facebook Live. And he mentioned that I think the digital divide score in Ballard County is 86 point something. And so one might think, oh, that's not bad. But you're actually saying that is a very low score for digital proficiency, if you will.
Yes. So it is. The higher the number, the more the divide. And it's broken down into those two sections where the infrastructure and then the socio-demographic. So if I was a community and I was looking at Ballard County and my infrastructure score was like a 50, but my demographic score was like 100, then before I invest any money in the infrastructure, would say, okay, I've got to make sure the people who are in our community right now would have the skills they need to access internet if we were able to provide it.
Okay, so just looking here at this is Pendleton County's profile. And so Pendleton County's digital divide index score is 42.92. You're saying a community would look at the socioeconomic index score or the
No, they would look
socioeconomic
at
score?
the higher one at the infrastructure score, because that one's a little bit higher, and say, okay, that's the one that, because it's higher, that's contributing more to the divide.
I see. The infrastructure is contributing more to the divide. So we're going to see that in rural areas predominantly.
You're going to
But-
see both, because rural areas also have high levels of poverty and aging population as well, and the education rates are lower. So you'll see rural places will have probably both of those numbers will be pretty close to the same in a lot of our rural places.
Okay, so compounding factors.
Yes.
But in many urban areas, you're going to see, I guess, a low infrastructure score, but possibly a high socioeconomic score.
And that's, in the remote work paper, we were able to break that down by census tract so that you could actually see more about those neighborhoods, particularly when you get in urban areas, when you have such diverse neighborhoods within a single county. You really want to be able to say, okay, this pocket of this city, maybe they don't have internet as well, or they don't have the devices that would allow them to connect to the internet or the subscriptions. So I like it when it gets just a little bit more disaggregated, because then you can start saying, okay, well, the west end of Louisville, which tends to be a little bit more impoverished, that would be an area we would target, whether it's digital literacy or what have you.
And so the census tract data, is it included in the report that I've referenced?
So the census tract data is, we break down the vulnerability, which is a component of both the digital divide as well as the occupations that people have. I don't have, and I can provide that at some point, the what you're looking at by the census tract, but there's a lot of them.
Oh, sure, right. But from a community, again, so you are community and economic development. So really thinking about how the community would use this tool. For example, in Louisville, it's really important that they have that census tract data so that they can pinpoint the problems and then identify solutions to those problems.
And that's been our problem all along, is that we have great programs, but we don't target the populations well that would benefit them the most, right? So if we have digital literacy and our programs are accessible by individuals who are higher wealth or higher educated, then it's really not effective. We really need to figure out exactly how to deliver those programs to those people who need it most. So having those more disaggregated data would be really useful.
Absolutely. So Alison, if there's anything that we can share publicly, I know we will have members of the Prichard committee and other volunteers as part of our work who are very interested in that census tract information.
Okay.
Particularly now, as we kind of kicked off, we're wrestling with what school reopening looks like and what will largely be virtual platforms for learning. And we know that broadband internet is not universally accessible. And even where it is accessible, it may not be strong enough for a family to all together work and learn at home.
Absolutely.
So can you address that kind of nuance there about the, I guess, the strength of broadband, or the different kind of levels of how we think about, our cell phone, we can get on the internet, hotspots, we can get on the internet, and then we've got fiber. And we need to understand the difference in these things as we think about remote learning and remote work and what access really is appropriate.
Absolutely. So if anyone has children and they are a full-time worker, and when we still had school in session, but they were remote learning and we were remote working, if anyone had internet that was a slower speed, both people could not log into Zoom at the same time, right? Because your bandwidth wasn't high enough. And so there are all different types of speeds at which you can access broadband. And the more folks that you have that are utilizing broadband, and particularly if it's anything that's video related, like we're doing now, or students are getting in and watching their teachers present, or they're streaming something from Netflix, you all can't access it. It's not like you get the same speed with everyone on versus just one person on. So a lot of folks have actually used their cell phones in many places because they'll have higher speeds than they will with the broadband that they have at home.
Wow. And so that's what that's a way of providing a hotspot in someone's home.
Yep.
It's basically just internet through your phone.
Yep.
Which isn't, could we argue that's not really the type of appropriate access that we need for a 21st, soon to be 22nd century economy?
No, I mean, it really, since I travel a lot to rural places, there are times where I've tried to use my phone as the hotspot for my computer, and it's slower, it's sticky, it's not something I would ever want to rely on. I think they make some decent hotspots now that you can purchase. There have been some really cool programs through libraries, not that I know of in Kentucky, where they have hotspot lending programs where it's a faster speed than what your phone would give you and more uninterrupted. But it's still not the same thing as having, dark fiber running to your home where it's just uninterrupted and just very fast paced.
So you started to mention the FCC and how the FCC measures the divide or broadband access.
Broadband access, yes.
So kind of unpack that for us and where there might be maybe gaps in our understanding or gaps in our conversation as we're pushing on Congress and others to really ensure that we have universal access. What's the difference in how the FCC defines these things and how you're looking at them through your research?
So you'll often, if you hear someone say FCC data, you hear someone groan. And in the absence of no other data, it's something to have in front of you. But you can take it to any community outside of a large metropolitan area and show a community the FCC data, and they will just immediately start arguing over it. Because what the FCC data will do is if there is one household within an area that has access to broadband, they consider the entire area covered. Wow. And so if I have access and my neighbor down the holler doesn't have access, but because I do, it shows that he does. And so then they're like, well, you're fine, right? So there's no need for investment. So that has been the case, and everyone is very well aware of that. There are all kinds of different sources to try to do some testing, like Microsoft had an upload-download test, but it's all user-based. But that's what you really need to do, is you need to have people within a community do a testing, where they can upload data, download data, and it gets registered so they can really figure out how you're covered. But for right now, the FCC data are really the only ones that are accepted by the federal government when you're thinking about investment, which is really unfortunate because we know that it's not a true reflection of the ability to access.
So the FCC's data would show that Kentucky is much more connected than Kentucky actually is.
Correct.
So if through our kind of broadband efforts in the state through various initiatives, a lot of headway's been made. But I think about some of the headway with E-rate, which is primarily through our schools and libraries, and they create zones of connectivity. Are you saying that those kind of zones of connectivity in a rural area that exist in a school or in a library would then show that the community, the larger swath of the rural area is also connected?
I don't think at that institutional level it will be. It's more at the residential level.
Okay.
No, so I think that's okay. You can keep doing that without, trying to
data. Okay. Okay.
Yeah.
Okay. But if Congress is looking at this issue, it shows that Kentucky's more connected than Kentucky actually is when we're all trying to work and learn and access healthcare at home.
And it is useful. I've had conversations with Hilda Legg, USA Rural Development Director, where they do invest significant funds. And she knows, so everyone knows about it. So the way they invest based on sort of ground truthing of, do they actually have data, have access? And so I think it's just something to use and to look at, but in terms of research and in terms of convincing everybody that the need is there, it makes it really challenging.
So you and your colleague at Purdue then are kind of providing an alternative to how we think about access to broadband, access to the information superhighway, how we measure it and how we break it down into different components of quality, I guess.
Exactly. And I think
Right.
with that digital divide profile, there is something there about the upload download speeds, but it's also complemented by, well, how many of our households actually have subscriptions? How many of our households have computing devices? Because if I live in a household and I don't have a computer and I don't have a subscription, then either that means I really don't have anyone to subscribe to, or it's just exorbitantly expensive, or I don't know how to access it. So I think all those put together make it a much more interesting story.
Mm-hmm, absolutely. So Allison, in your work then, in rural areas, urban areas, states, what are some of the best practices you're seeing as communities and states begin to grapple with this issue? Have been for a number of years, and certainly are now like never before.
So I'm part of a national extension team. It's called NDEET. I don't know what any of the letters stand for. So I just know when I see it in the subject line. Okay.
NDEET?
NDEET.
EET.
And I participate as much as I can, but I keep my eyes on what other folks are trying to accomplish, particularly during the pandemic. And for example, last week, one of the questions was, how many of our extension offices have opened up their Wi-Fi for the public to use?
Okay.
Which is, it's a great location, it's a great public area. There's, you can socially distance if you typically have large conference rooms or, meeting rooms. And so almost all of our states have opened up their county offices. So that led us to, go to our state and be like, what can we do? Some states have a very clear broadband plan. And I guess I was surprised at Kentucky that our plan is the Kentucky Wired plan, but I'm not sure that folks know that or feel like that their interests are reflected in that. Particularly because Kentucky Wired is predominantly focused in Eastern Kentucky, where their infrastructure largely is. And folks out Western Kentucky feel like they too don't have access. So it's not, they may have different terrain, but we don't have a plan at the state level. It's very kind of hodgepodge, regional, county based. And I've seen other places that have had more centralized focus that seem to have sort of, okay, here's where our priorities are, and here's where we're gonna make investments. And you've got all the partners at the table coordinating with each other. I don't see that in Kentucky. I think that would be hugely beneficial.
And when you say partners, you're thinking about the service providers that exist in the state, I'm guessing, or those potential service providers?
Service providers, educational institutions, the largest workplaces, all those that need to ensure that both the business, their workers, and the families have access to broadband. We've looked in the past, and this was back in the day when broadband first came around, but we surveyed the fastest growing manufacturers in the country and said, given this list of location attributes, what is the most important one? And 10 years ago, it was broadband.
For like site location, if a company is looking to come to a state, they're looking at broadband access.
Yes, and then came workforce, and then came hospital. So I can't even fathom that if a place doesn't have broadband, how you would ever be considered for any type of economic development investment. So it's everybody's problem, right? So to have multiple stakeholders, healthcare institutions be at the table and say, okay, how is this affecting, each of our stakeholders, and, sort of come together with some objectives and strategies out of that.
Interesting. So in Kentucky, we've got the kind of the rural telephone co-ops, the electric co-ops who are trying to get into that service provider arena, and then of course we have the big providers as well. And so, do you see that in other states, kind of this cobbling together, even if there is a state plan of who's providing?
Yeah, the subscribers, the companies are the biggest, to some extent it's the biggest concern, because when I go into a rural community, they say, oh, let's just build the infrastructure, and they can get a grant to build the infrastructure. That's great, except for AT&T is not going to go into a community where they cannot make money, right? And so if you go into Ballard County, or you go into, go Ballard, Carlisle counties, a large corporate subscriber is not going to want to go in there because they're just not going to have enough subscribers. And particularly if they see the digital divide index and they say, wow, look at the age of the population and the income of the population, we're not going to get a lot of uptake. So having this group of private, but then having sort of the more utility, like PRTC, which is in Eastern Kentucky, they've been amazing, but they've been more kind of on the sort of representing the needs of their communities probably more. So having all those folks at the table, I think, is important, but I do see that in lots of different places.
Yeah. And then through the kind of, as we're a few months or so into the pandemic now, so, it hit in the middle of school, rapid response, hotspots, people expanding their Wi-Fi so that families could pull into parking lots, drive-in hotspots. Now we've had a couple months over the summertime, and we're making more intentional plans for reopening. Are you hearing about kind of next step measures? I guess maybe even midterm measures. We're not all the way there yet, but next step, more sustainable measures to get more folks connected?
No. I mean, I've heard a little bit, the state's so different in terms of their access and their strategies. Kentucky Wired in Eastern Kentucky trying to get the middle mile completed, but we still don't have last mile in place in many places. And that then becomes a subscriber issue, which then becomes a profit issue. Western Kentucky, I know that there is an electric co-op that is trying to get into this space, right?
I believe that's Energy.
Yeah.
Mm-hmm. So we have them on. Yeah.
Good. Yeah. So I think that's excellent news that there are some folks who are taking on wider swaths of the state than in just a particular county. But I don't see any short-term real response to this.
How about we think about, I'm sorry, go ahead. If we think about those census tracts, if we think about Louisville and certain census tracts where you've got a good score in the infrastructure space, mm-hmm. but you don't have a good score in the socioeconomic space, in particular census tracts. Yeah. Are you hearing about, one of the things that's popped up in our conversations is just like a pool of funds to actually provide like a waiver for actual service, not just a hotspot, but actually provide the service to a low-income family. Any kind of innovative stopgap measures like that get us past hotspots? Yeah, I think, PRTC is my best example because I just find them to be so innovative. I mean, that's what they did, is they just turned on internet for everybody during the pandemic. And I think, I haven't talked to them recently to see what they'll do for the fall. And I think they're waiting to see all the final school decisions. But my guess is that they will themselves come up with a solution to ensure their students have access. I mean, it's in their own best interest. Mm-hmm. If their students and their families can't get access and their education is lagging, then people will leave and they will have fewer subscribers, right? So there's an altruistic and there's also a genuine financial need for folks to subscribe. So I think there are some of the utility-based companies that will likely do something. As we PRTC, the PRTC is what? It's the People's Republic Telephone Company. Okay. It covers, to me, what I consider like the
lowest income counties in the state. So like Clay County, Leslie County. So it's a Southeast Kentucky telephone company that has amazing fiber to the home.
Okay.
And like
In
Alison,
Jackson County, maybe through the telephone co-op?
yes. So
Okay. And we've
yeah.
talked to Keith Gabbard there.
Yes, Keith. Yes.
Okay. Okay.
Yes.
Okay. So they just flipped a switch. Everybody's on.
Everybody's on, right? So in places where that, that it's not necessarily the same company, as our, we saw a lot of our cities and counties mobilize funds to support businesses, when they had to shut down.
Mm-hmm.
My guess is that's probably a really good way to spend future, investment dollars. I haven't heard anyone saying that they're going to do that. I think most people thought it would be over by now.
Yeah, right, right.
Yeah, I've heard things about, opening up the schools to those who don't have it at home, and just, they won't be learning anything differently. They'll just be able to access their computer from inside the school building.
Mm-hmm.
But I haven't heard anything that says, oh, that's great. We've got the state covered now.
Mm-hmm. So and that can be kind of a stopgap measure for learning, certainly. But as we think ahead, as we've talked about, if we think about remote work and remote access to healthcare, there's still going to be growing demand for folks to be able to connect and connect appropriately, adequately at home, in a way that's that they can afford.
Yep.
And so let's shift gears just to healthcare for a minute, because you mentioned you've been doing some work in that arena and access to healthcare and the importance of broadband for access to telehealth. Yeah. So give us a little bit of background on kind of what you're doing in that space and what you see on the horizon.
Sure. So my work with rural health is largely around access and sort of the importance to local economic conditions. And a lot of rural hospitals and providers had access to capital to purchase equipment that would enable electronic health records and then telehealth equipment. And up until the pandemic, it was not utilized. They had it in place. They had software that they purchased. They had to do the EHR stuff, but they weren't using telemedicine in many places. And so when the pandemic hit and these rural hospitals had to essentially close because they didn't have any elective, or they didn't have any COVID patients. All the COVID patients are being transported up to urban hospitals, and they didn't have any elective procedures. So they had no revenue coming in. And these are to these poor hospitals that are already financially very distressed, in addition to clinics and so forth. So for patients, for rural folks who needed, to either see a doctor to get prescription refills or what have you, telehealth became a very important way to communicate with the doctor. And the CMS, Center for Medicare Services, they relaxed the billing for that, so that folks who didn't have access to the internet but could communicate via phone with their doctor, the doctor could still get reimbursed. So that's great, but that will phase out. But there's no way telehealth is now going away. I've watched my husband now be able to communicate with his doctor 4 times without having to take a day off of work.
Yeah. You get spoiled, right? Because you just have to block out 15 minutes on your calendar. You don't have to go anywhere. It's very nice. It's
wonderful. And it keeps the money, you're able to keep some of that money locally because you can go to your local providers. And so it's not going anywhere. I think, they'll have to spend, Congress will have to figure out exactly how they need to recraft the billing for that. But it's not going anywhere. People became very comfortable with that. People, particularly in rural areas, will be a little bit hesitant to go back into a large healthcare facility, particularly with COVID scares. So it has been a lifesaver, I think, for the healthcare industry.
Yeah, and again, an argument in favor of folks at home having appropriate access.
Absolutely.
Yeah. So Allison, as we kind of wrap up our conversation, and I so appreciate you taking out this time this afternoon to talk with us about your report and this issue that will be unraveling and kind of evolving in the months and year to come. As you think of through the lens of community and economic development, so you're coming from the initiative for Kentucky. What do you want community members to do with these profiles? What's your big hope that they'll take that profile and do what?
I think there's a lot of digital literacy that needs to occur. I certainly think that everyone should have the ability to access high-speed internet. I think in today's day, it's almost as important as water and
electricity.
Electricity, right? But what I don't know. This is just anecdotal, and I don't know what the status was of households. But I know when school closed, I heard, whether it was on the news or somewhere, that when we go to these online course shells, you can check when students are checking in. You can see, oh, they last logged in. And when the schools closed, there were some students that never logged back in again. Whether that's because they didn't have access or whether it's because they didn't know how, but that's a very scary reality. And so I think the digital literacy for convincing families that this is an investment. I mean, I spend $90 a month on some pretty crappy, not terrible, but reasonable broadband. It is not a small investment, but it is an investment in my career. It's an investment for my kids. It's just an essential. So you have to be able to convince folks within these communities that this is something they should have and that they should spend money on. And if they don't know the value of it, then any investment in infrastructure is going to be a waste. And so I think making sure that your digital divide on that socioeconomic score is as low as possible, or that you've convinced yourself that you have programs in place so that those that are disadvantaged will be able to access the same as someone who isn't, I think is critical. I'm hoping that just soon, we'll figure out an easy way to do this. Every day I see a new invention coming that will be able to provide, 5G or internet, satellite internet, and that'll affect certain places differently. Appalachia is still a disaster with all those mountains. Like, it's just not easy to blanket a place with Wi-Fi. So, while we're waiting and while we're trying to secure funding, I would say we need to make sure we work on that socioeconomic score.
Okay, excellent advice. And that's something we can all work on. Allison, thank you so much for your work, which it's so timely, coming out in March before the pandemic really kind of soaked in. Yes. And now we're all using it as a really important resource. And so we hope to help you make sure those profiles are being used in communities to figure out how we take next steps and realize that big, bold future as Kentuckians that we know we can. Thank you for your time today.
All right. Thank you.
Okay. Bye-bye.
Bye.